Hello and welcome to this lecture. This lecture deals with therapeutic communication. This is one of the basic skills that nursing students have to demonstrate, and so the other healthcare providers. My name is Thomas. On the introduction, we are saying that communication is emphasized. It's emphasized because it is critical. It is critical for the success as a beginning practitioner. You, as a beginning practitioner, you have to learn the art and the skill of communicating for you to communicate better and understand your client. For that reason, we talk about therapeutic communication, and therapeutic communication means listening to and understanding the client while promoting clarification and insight. So whatever is not right or not clear from the patient, you have to ask for clarification. Insight basically means a situation whereby patients do appreciate that they have a certain condition or disease and that they need medication for them to get better. Of course, I have to remind you that you're going to encounter this term, especially when you're working on the psychiatric or the mental health wards patients. Therapeutic communication helps the nurse to form a working relationship with both the client and the healthcare team. The healthcare team consists of different cadres, which include the physicians, the clinical officers, physiotherapists, nutrition, laboratory, mention them. So this normally involves the use of verbal and non-verbal communication. Remember that nonverbal communication is the most critical or accurate reflection of attitude. So you can allow us to look at this quiz. I'll give you a minute to look at it. The terms judgment and insight are sometimes used incorrectly. Insight is the ability to Clinician A, make appropriate choices. Clinician B, control inappropriate impulses. Clinician C, explain one psychiatric diagnosis. And Clinician D, understand the nature of one's problem and situation. So the correct answer in this case is number D. And in this case, we've said that insight is the ability of one's to understand the nature of one's problem and situation and to appreciate so that we can improve on the health-seeking behavior. Addition notes on that, you're saying that insight is the ability to understand a situation or a problem and its effect on one's life. Judgment is the ability to make appropriate choices and behave in appropriate manner. A client may be able to explain the psychiatric diagnosis but may lack the insight to understand the underlying problem and how it's affecting the client's life. That was tricky, but you are able to appreciate that. So we have therapeutic responses. These are responses from healthcare providers that we term as being therapeutic, appropriate for that situation. And we have various responses and goal and purpose. Using silence allows the client to think and reflect, conveys acceptance, and allows the client to take the lead in a conversation. The client is supposed to take the lead in the conversation, and that's why we advocate for the use of silence as a way of a therapeutic response to the client's needs. The other goal is using general leads or broad opening, which encourages the client to talk, indicates your interest in the client, allows the client to choose the topic. We are kindly reminded that we need to allow the clients to choose the topic for the discussion and not the other way around. The other role is about clarification, and this one encourages recall and details over particular experiences. So it encourages descriptions of feeling, seeks explanation, and normally pinpoints specifics. So clarification, especially when something is not clear, it is upon you as the healthcare provider to help so that the client can clarify what was not clear to you. And lastly, the skill of reflection. And you're saying that this one we paraphrase what the client says and it reflects on what the client says, especially the feelings conveyed. Remember, therapeutic communication touches on the client's feelings, and that is so important. We have a quiz here. I hope this one will not be that challenge. Saying that a serious ill client spouse tells the nurse, I would like to be physically close with my spouse, but I'm afraid of causing pain if I touch my spouse. How does the nurse or clinician respond in this matter? A. You will not hurt your spouse through simple touch. Intimacy is important and encouraged now. To B. It is normal. It's normal to fear causing pain. What kind of contact did you want to have with your spouse? Clinician C, I can provide pain medication to prevent any pain. Will that make you comfortable? I hear you saying that you do not close your spouse. Can you tell me why you feel this way? I'm going to give you a minute so that you can actually tell me what is the best response so far in this case. Well, guys, if you look at the first response, it's talking about will you not hurt your spouse through simple touch? Intimacy is whatever. Why is this one incorrect or correct? The first thing I want to say is that this option B appears to be the correct option, and I need to explain why. In this case, for the first one, you will not hurt your spouse through simple touch. Intimacy is important and encouraged now. This one does not address the client feeling. Remember, the client feeling was I am afraid I'll cause pain. The second part of it, this healthcare provider has already concluded that the kind of touch included here is the intimacy, which should not be encouraged. I can provide pain medication to prevent any pain. Will you like to, how will that make you comfortable? The reservations I have for this answer is that this one is a closed-ended question and it does not encourage the client to talk. So it blocks the communication. The healthcare provider can no longer communicate with the patients. I hear you say you do not feel close to your spouse. Can you tell me why? We are saying that never ask the patient why. Yeah, never ask the patient why. Patient why? Why? Should never be encouraged. It's a no. Okay? No. So no. Good, guys. I think you can have it that way. Yeah. That is it. So wishing for physical contact with serious ill love is normal, but fear of causing pain is common. The first action the healthcare provider needs to take is to clarify the type of physical contact with the spouse wishes to have with the client. The spouse may desire more intimacy than simple touch, so this should be explored. but we can never make just judgment. Simple offering analgesia does not explore the spouse's desire for intimacy. The spouse did not say he or she did not feel close to the spouse in an emotional sense, but expressed the desire for physical contact. Reflection. We have a client is hospitalized for a round of chemotherapy, reports being very distressed at being unable to sleep because of series of roommates who have been actively withdrawing from opiates. The nurse responds that they must accept clients who are detoxing from prescribed and illicit drugs. Which action should the nurse or the healthcare provider take? The clinician should advise the client to ask the physician to transfer to another ward, ask the client's physician for an order to avoid this type of roommate, recommend that the client request to sign against medical advice or explore difficulties, identify solutions, and negotiate short-term gains. When you go through all these responses, you find that option D is close to what we really want. Remember that we are having that feeling aspect to the client. We need to explore the difficulties, identify solution, and negotiate short-term gains or aids to the client, and that will make the patient comfortable. It's unethical for us to force the patient to sign against medical advice. The nurse needs to identify the conflict the client is experiencing and discuss specific areas that are problematic, such as sleep, and identify solution and offer interim compromises where possible. It is never therapeutic to involve the physician and inappropriate to suggest a transfer or written order to limit roommate assignments, which are the purview of nursing. Recommending that the client sign against medical advice is unethical since the client requires treatment. Guys, we have to remember that there are some phrases that we need to avoid as much as we provide care to the patients. Phrases such as do not worry answers. We need to eliminate it from our conversation as much as possible. Eliminate responses that offer false reassurance. A client is complaining of blah, 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 blah. The healthcare provider tells do not worry. These type of responses discourage communication between the healthcare provider and the client by not allowing the client to explore his or her own ideas and feelings. So false reassurances also discounts what the client is feeling. Examples like it's gonna be okay. Do not worry. Your doctor is doing everything necessary for your care. These are some of the responses that we need to avoid since they are just aimed at false reassurance. Let's explore answers, and this is an incorrect choice. Many healthcare providers will want to explore. The client must be allowed to verbalize the fact that he or she is mad, angry, fearful, overwhelmed, and we have to give clients that space. Examples like let's talk about why you didn't take medication is completely non-therapeutic. Tell me why you really injured yourself. It is non-therapeutic. It only makes the client to be defensive and no therapeutic response is achieved. So ladies and gentlemen, we have to avoid this thing of why questions. We always say don't never ask the patient why. Why questions are the ones that one seeks reasons or justification. Why questions imply disapproval of the client, who may become defensive, right? A why question can come in many forms and need not always to begin with why. Any response that puts the client on defensive is non-therapeutic and therefore incorrect and therefore should be avoided. Examples. What makes you think that? Why do you feel this way? Why did you not take the medication? Why are you coming late? Why did you disobey the time to come back? These are why questions that don't need to be encouraged since they are not therapeutic. Remember, they are areas, situations where we are exempted. There's an exemption of use of why, especially when you're dealing with a patient with suicidal ideation. That's when you're supposed to go directly and ask the question, if you have plans of committing suicide, we ask directly. But otherwise, never use the question or the phrase why. Why? Why must stop. Thank you. Authoritarian answers or comments. We are saying that we try to avoid such. These are instructions in which the healthcare provider is telling the client what to do without regard to the client's desires or feelings. Example like insisting that the client must follow unit rules. Nurses, you hear me? Insisting that the client do what you command them. Clinicians are good here. Even physiotherapy here. You are forcing the client to do exactly the way whatever. We're saying that that may not be therapeutic. Okay? Yes. Client for clinician focused or nurse focused answers or direction. We're saying that you need to avoid such statements or focus of the comment. Yeah? Because these they may sound very empathetic. The focus of your communication should always be on the client and not any other else. You should never refocus or redirect the focus to yourself, your spouse, your relatives, your neighbors. The focus should always be on the patients. Examples of non-therapeutic statements in such category include, that happened to me once. You are comparing this patient situation to yours, and it's not correct. The focus must always remain on the patient. I know from experience this is hard for you. That is nurse focused, client focused responses which should be provided. I know of these guys who go to a funeral and they're trying to console their friend. They tell him, "Oh, I know how you're feeling. This is the time you need God most. I've been there once again." All these are non-therapeutic responses and have to be avoided as much as possible. Let me give you an example where there is someone here. A couple is in the antenatal unit, is not satisfied with the care they are receiving. They have spent the past 15 minutes expressing dissatisfaction to the nurse about the care the client is receiving today. What is the most appropriate response by the clinician? Explain that the unit is short-staffed, and that the nurse are doing the best they can. Is that what you're going to tell the caretakers? Look at this one. Call the nurse manager to speak with the couple. That is like calling your supervisor. Encourage them to talk for 10 minutes. Yeah, you like this part? Then remind them that there are other tasks to perform. This is not correct. This is completely out of place. It's not therapeutic at all. Encourage the family to identify their frustrations and fears. Yeah. We're saying that this is the best response so far. Explaining, giving clients space for them to talk and be sure so that their frustrations can be heard and everything about them can be gotten at least. Okay? Yes. So the response will assist the healthcare provider about in identifying their frustration and fears so that the nurse can work towards resolving their issues. It is inappropriate to tell the client about staffing related issues or give them time limit which they are able to express their concerns. The nurse manager may need to be brought in the situation, but first the nurse should try and work out solving the issues with the client. The next aspect is an closed-ended question. Hold on. Hold on, hold on, hold on, hold on. Okay, we can proceed that on closed-ended questions you need to eliminate choices or responses that include closed-ended questions, and I think I had mentioned this in the opening remarks. We are saying that closed-ended questions, these are yes or no or another monosyllabic response that needs to be avoided. Closed-ended questions discourage the client from sharing their thoughts and feelings. They include things like, are you feeling guilty about what happened? Yes or no? Is that therapeutic? No. How many children do you have? Two, three? That's not therapeutic, right? And we don't need to include these ones. Eliminating these response types appear as answer choices, as effective strategy when answering therapeutic communication questions. Don't simply look at the specific words that you see here. You may need to translate the answer so that you know if it is a yes or no answer. So how do you select the correct response? By choosing the answer that are left. The correct response usually contains one or two of the following statements. There is an exception of closed-ended questions, and we say when you're working with patients with suicidal ideation, like a client lives in a group of home and visits the community mental health center regularly. During one visit with the nurse, the client states, the voices are telling me to hurt myself again. This is probably a psychiatric patient, yeah? So we are saying that this is the time to ask exactly, yeah, so that you know, you confront. So which question by the nurse is the most important to ask? So when do you hear the voices? Are you going to hurt yourself? How long have you heard the voices? Why are the voices stating? Of course, this one can easily be eliminated. We are saying never ask the patient why. Okay? Yes. How long have you heard the voices? Are you going to hurt yourself? This one could have eliminated it, but you can see it is a direct closed-ended question and is asking the patient if he's going to hurt himself. This is the exception where we use this closed-ended question, and that makes it the correct answer in this case. So the nurse needs to ask the client whether he is going to hurt himself or determine the client's ability to cope with the voices. To assess the client's impulse control, the nurse assessment will then determine the course of action to take regarding the patient's safety. Asking when the client hears the voices and how long the client has heard them is important, but not as important as determining whether the client will act on what the voices are saying. Asking why are the voices starting again will be inappropriate because the client may not know why, may not be the answer for this nurse. Okay, so I think you've seen the exceptions there. Another question here comes again. I'll give you a minute again. You look at it. And we're saying that a client is admitted to the healthcare facility with acute chest pain. When obtaining the client's health history, which question will be the most helpful for the nurse to ask? Do you have a history of Gastroesophageal reflux disease. Gastroesophageal reflux disease, I know you're going to look at it later, but if you don't have an understanding of GFR, you can just click on the link and it will take you exactly to a lecture that I've made on the same, and you are able to appreciate gastroesophageal reflux disease. Have you ever had pain like this before? What are you doing when pain started? Do you take medication on regular basis? So these clients are admitted in the healthcare with acute chest pain. When obtaining the client's history, which question will be the most helpful for the nurse to ask? Do you have a history of GFR? How do you see it, guys? So I'm going to give you a minute. So subjective about chest pain helps the nurse determine the specific problem. For example, asking about the setting in which the pain developed provide a helpful information about its cause. So asking about the history and medication will yield information but not will not be helpful. Can see someone saying I highlight the questions, the answers. So it's here. So what were you doing when the pain started? So have you ever been pain like this? Yes or no? Do you have a history of this one? Yes or no? Do you take medication regularly? Yes or no? And that's why we are simply arriving at what were you doing when the pain started. I hope you get it, guys, and it should be easy for all of us. When you try to look at summaries on therapeutic communication, we're saying that therapeutic communication, you need to give correct information. Offering information encourages further communication from the client. Examples of correct information include you are experiencing, like if you have an alcohol withdrawal client, we say that you are experiencing acute alcohol withdrawal. You may see things that aren't real. There are many reasons for memory loss. Tell me more about what you have noticed. Encourage the client to talk. Open-ended question. Now, in these questions, I want us to use the right information is the technique that we need to use here. So for this client is a client who is taking antidepressants. Imipramine is a tricyclic drug, antidepressants. If you've not heard of the tricyclic antidepressants, I want you to visit my videos and look at tricyclic antidepressants for depression. So this one has been taking antidepressants for 2 days. His sister asks the nurse, why is he still so depressed? Which response by the nurse is the most appropriate? Your brother is experiencing a very serious depression. I will be sure to convey your concern to the healthcare provider, in this case the physician. It takes 2 to 4 weeks for the drug to reach its full effect. Perhaps we need to change your medication. What do you think is the most therapeutic response here? And this one depends on correct information, and that's why we're picking C as our correct answer. It takes 2 to 4 weeks for the antidepressants to start bringing, or the patient start experiencing the full effects of those antidepressants. We need to ask ourselves, is it empathetic and does it reflect the client feelings apart from giving correct information? We say empathy is the ability to perceive what another person experiences using that person's frame of reference. Reflecting communicates to the client that the healthcare provider has heard and understands what the client is trying to communicate. When reflecting feelings, the nurse focuses on the feelings and not the content of what is said. The following examples are some of the empathetic, reflective statements. Like I can see that you are frightened about being here. You seem very upset. Tell me how you're feeling. You see, this one encourages the patients to talk about themselves and they are able to talk more on the same case. Look at this one. A mother of a hospitalized infant appears anxious and displays anger with staff. Which response by the clinician is the most appropriate? A is, would you like the chaplain to come visit you? Would you like to talk about your concerns for your hospitalized baby? Having to be in the hospital is hard. Your baby will get better soon. You're upset. You are upset. You seem upset. Having a child also must be difficult. So, ladies and gentlemen, look at the first one. Would you like the chaplain to come and visit? Is a yes or no question. And we are saying that such questions are non-therapeutic, except when you're dealing with a patient with suicidal ideation. Okay, so this one is wrong. Would you like to talk about your concern for a hospitalized baby? Same problem, yes or no. Having the child to be in the hospital is hard. Okay, to some degree, I agree with this one. Your baby will be better soon. Oh, this is false reassurance. False reassurance, and this part is what makes this answer wrong. So, ladies and gentlemen, we remain with D. You seem upset. Yes, you have at least acknowledged that the patient is anxious and displays anger. Having your child hospitalized must be difficult. This is on reflection, and that is what makes answer D correct. Great, guys. Good job. Now, acknowledging the mother's feelings and recognizing that it is difficult to cope with a hospitalized child allows the mother to express her feelings. Asking the mother if she wants to talk about her concern only allows a yes or no response. It does not provide an opportunity for the mother to share or vent. The mother may want to speak to the chaplain, but asking does not address the issue of being fearful and angry. Additionally, the action involves the nurse delegating the problem to someone else without seeking out the root of the problem. Saying your child will get soon only gives false reassurance and does not address the mother's immediate needs. I hope you're together there, guys. I can give you another one again. Okay. So this one talks about a 12-year-old client says, "Give me my pajamas. I'm not putting your silly gown on." What is the most therapeutic response by the clinician? So this is a 12-year-old, yeah, says, "You give me the pajamas." He doesn't want to put on the gown. And of course, it's the hospital policy that patients must put on the hospital gowns. So let's look at the responses from different healthcare providers. Number one, "I know they are funny, but everyone here wears them." What is the problem with this question? Everyone here. It is authoritative. We are saying that you avoid authoritative responses. Yes, avoid authoritative responses. Yes. So this one is not what we want. "You don't mean that now? A big guy like you knows how hospitals are." Very good. This one is still referring to rules. And we are saying that you should not be authoritative, you should not be insisting on the client using the rules, and that's not therapeutic. Number last, You are upset because you think we are unreasonable. This one again is doubting the capacity of the, the, the client, and is claiming that the client feels that they are unreasonable, and that makes it untherapeutic. So the correct answer for this situation could be C. C, because it is touching on the patient feeling that you are upset because you feel awkward and embarrassed in these gowns, and that is close to what we really want. So the nurse uses active listening, in which client feelings are reflected back to the client. Telling the client that everyone wears them does not consider the client's feelings. Telling the clients that what he said is not what he meant discounts the validity of this statement. Interpreting the client's feelings as meaning that the client thinks the rule is unreasonable does not take into account how wearing the gown affects the client personally. Client family. So a client has an urinary diversion, tells the nurse, this pouch, this urinary pouch is embarrassing, and everyone know what that I'm not normal. I do not see how I can go out in public anymore. What's the appropriate goal for the clinician to set for this client? A. Manage anxiety about not being normal. Is that the problem? Learn how to take care of the urinary diversion. Is that the problem? Overcome feelings of worthlessness. Is that the problem? Express fears about the urinary diversion. So it's true that someone with such kind of operation, they're going to be having some incontinence. So they have to be taken through the use of the Kegel exercise to strengthen their pelvic muscle. To strengthen their pelvic muscle because of that frequent that is going to happen. So expressing concerns about the diversion helps to touch on the patient's feeling, and that's why it makes it correct for this situation. It's normal for clients to express fears and concerns about the body changes associated with urinary diversion, allowing the client time to verbalize concerns in a supportive environment, and suggesting that she discusses these concerns with people who have successfully adjusted to ostomy surgery can help her begin coping with these changes in a positive manner. Although the client may be anxious about these situations and may be feeling the feeling of worthless, the underlying problem is disturbance in body image, and that is the correct nursing diagnosis that needs to be taken into account so as to be able to move forward. A bit tricky, but that is it. The last question that we need to look at is this one, and the client is admitted to the emergency room with the diagnosis of acute myocardial infarction. The client tells the clinician that I'm scared. I think I'm going to die. Which of the following responses by the clinician will be the most appropriate? Everything is going to be fine. We'll take good care of you. I know what you mean. I thought I was having a heart attack once. I'll call your physician so that you can discuss it with him. It's normal to feel frightened. We are doing everything we can for you. It's tricky, partly tricky. Like when you look at the first one, everything is going to be fine. We'll take good care of you. This is false reassurance. Very good. False reassurance. Everything is going to be fine. Yes. False reassurance, false reassurance. I know what you mean. I thought I was having heart attack once. So in this case, you're comparing client situation to yourself, and you're telling the patient you know what it means. So these are nurse-focused, clinician-focused responses. I'll call your physician so that you can discuss with it. The client says he's going to die, he's scared he's going to die. Yeah? Does that need a physician, a specialist? The clinician can easily handle the client for a case. So this one is passing the ball, okay? What about the last one? It's normal to feel frightened. Yes, it's normal to feel frightened. This one has a feeling tone, and that's why this one is correct as opposed to the other one. So guys, I'm going to leave you with this one now, the last one. We are saying that the nurse is caring for a client who lost a spouse 4 months ago due to brain tumor, and the client shares a plan to get remarried in few months. The client states having truly loved the first spouse, but being happy again and excited to move forward with life with the new fiancé. What is the nursing best response? I'm happy for you, but I'm very concerned that you are rushing into things. Did you see a grief counselor? Getting married so soon after your spouse passed away must be very stressful. Would you like to talk about it? It sounds like you are in a good place in your life now. Congratulations. I wish you all the best in your new marriage. I'm sure your spouse is looking down from heaven and is happy that you have found happiness. Congratulations. So, guys, you can attempt this question and share your responses. Share your responses so that we see how you have interacted with the lecture. Thank you so much. You can share this one, the lecture, with also your friends, and remember to subscribe. Thank you so much.